CHII, we are so impressed to see the innovative work going on within jurisdictions around data modernization. Recently, we had the opportunity to speak with the Minnesota Department of Health about the work they're doing with data lakes, which are really centralized repositories that store different types of data in different formats from different sources. And so we sat down with Åsa Dahlberg-Schmidt, who is up until recently was the director of the Office of Data Strategy and Interoperability, and she spoke to us about the challenges they faced and how they overcame them.
Yeah, so before we had the lakes, a lot of the data sharing was just a very manual processes, like a lot of people extracting data from one system and then maybe putting them on a network drive or maybe creating some database where they would combine it together. It's a lot of manual work, a lot of data manipulation, a lot of it's hard.
In 2020, Åsa's team began building data lakes for the different types of data within public health. And this really allowed for public health professionals to have the specific data they needed, while also being able to be connected to these other data lakes in the event that they needed a richer and more robust amount of data.
So it's a difference from just where kind of moving it and putting it to your own desktops or in your own network drives, your own computer, to being able to access it somewhere where you can kind of do some of that manipulation. It's easier to get access to the data, it's easier to combine it, it's easier to know where it is or to find it.
So during the COVID-19 crisis, the data lakes proved to be really essential because it allowed for them to connect different information. They were able to connect immunization rates to COVID case data and create maps that allowed for them to see where their COVID-19 vaccination sites were. When they looked at everything from a complete picture, they could really see if they were meeting the community's needs.
I can't even wrap my head around how we would have managed the pandemic if we hadn't had it. Just with all the volume of data, how we needed to combine the data, the people that needed access to it. I can't imagine how we would have done it without the data lake.
While accessing and combining data became more efficient, the state of Minnesota still had their fair share of obstacles. For instance, in 2020, when the data lakes were created, there really wasn't time to put in place formal governance structure. And this meant that Åsa was the owner of the data and received all requests for access and determined the level of access for each individual request. And she really encourages anyone who's considering developing a data lake to start with these questions and building a governance structure before they create the data lake.
How do you want to do the ownership? How do you decide if you're going to change the technology in the data lakes? How are you going to set it up? What's the rules around if you start combining data? Some of those things I would recommend you have already decided or thought through before you're doing it. I also think utilizing technology to do more of the work also free up our epidemiologists to do more of the, not just dealing with the data, but actually learn from it and take action based on the findings there. If we do it right, I think that it will free up people to learn and use data in a different way, to draw conclusions, to tell stories with data instead of just massaging and manipulating and fixing and entering data.